is Amanda Sweeney with the Christian County Health Department, and I'm here today with Chloe Rager. Now, she's one of our newer employees. You guys have met her on earlier CCHD chats, but she's been doing a lot. If you've been following our Facebook page, she's been doing a lot of our posts, a lot of updating you on most frequent information that we have out there. So she's been doing a great job with that. And since she's been in the know with a lot of this stuff, with a lot of the questions that you've had, she's actually the one that collected a lot of our questions. She's been answering a lot of your Facebook questions. I wanted to pull her in as well, and what we wanted to do today is a question and answer with you guys so that we can talk about some of these common concerns and questions that you've had in the community. So hopefully by the end of this, you'll have more information and be more informed about how to fight COVID-19 and just feel more comfortable as we proceed through this process of trying to battle COVID-19. On a sad note, before we get started, we did just report, you'll see on our Facebook page, that we have had 2 deaths in Christian County. So our hearts go out to those families, our thoughts and our prayers are out there with you. More than ever, we just want to reiterate, make sure you're practicing that social distancing, make sure you're washing your hands frequently. If you are exhibiting symptoms, please make sure you visit your primary care provider, call first, and get tested. And if you are in the process of waiting on tests, make sure that you are at home in self-isolation or self-quarantine so that you're not potentially contaminating others. We are sad to report that, but we did want to keep the public informed about what's going on. But we're going to just dive right into these questions. You guys have had several. Thank you for sending these in, and we're just going to dive in and get started. First question was, is it required to wear a face mask when you're out in public? So I'm going to let Chloe take the first one.
So it is not, we get this question a lot, and it is not required to wear a face mask when you are out in public facing businesses, but it is recommended by the CDC, the Center for Disease Control, to wear a cloth face covering that's at least 2 layers of fabric and that covers your chin and your nose. And so you want to make sure that that covers your whole face where you'll be breathing in those things. So it is recommended, but not required.
You said cover your chin and your nose.
Chin.
I like that.
Chin, my nose. Yes. Another question is, what kind of mask should I be wearing? There's a lot of different types of masks.
Good question.
So what kind of mask should I be wearing?
There are lots of different types of masks. And also you may have seen this. I know Chloe put a post about what masks should we be wearing and which masks are medical providers wearing. So let me just dive into medical providers first. This is what we call an N95 mask, and this is what a lot of people have asked for. We're, as a health department, we have some of these in stock, but we are reserving these for our medical providers and emergency services. And we ask that you out there, when you're looking for masks, that you deter from these, because we do not want to have a shortage of these, because our medical providers are going to need these N95 masks. So you'll see a lot of them where you may have seen these. They look familiar in the hospital setting or in your doctor's offices. We've also got our surgical masks. This is also another common one that you see in the hospital. We do have these in stock here. Again, we're providing those to medical providers and emergency services for the most part. So try to steer clear away from these as well. But these are 2 types of masks that you'll see in the medical and emergency fields. Another type of mask, and kudos go out to Chloe's mom, Leslie. She's been making masks, and a lot of people out in the community have been making masks as well. And one of my friends from church, Nellene, also made me one very similar to this. But this is a cloth mask, and I believe if you want directions for this, we can post those. We can find those on Facebook. But a lot of people have been wearing their cloth masks and put them over their face, and that's just going to prevent those germs and the airborne sputum or anything that's out there from getting on your face. So these are 3 types of masks that you can use, or that we prefer the public be using the cloth masks or covering your face. And then these are the 2 types of masks that our medical providers and emergency services would use. Also, a bandana, any type of cloth covering for your face is going to be adequate for that, just to prevent the spread of germs. Our next question, this is a popular one. Can churches gather this weekend for Easter for drive-in or other alternative services?
So we know that with Easter this weekend that we all miss our congregations, we miss our church families, but we cannot have churches gather in person right now. There are some alternative services. A lot of churches you'll see are doing live streaming. Our church is doing live streaming. Many of them are doing that on their Facebook, but some churches are doing drive-in or drive-through services. And it is okay to do drive-through services, but there are some guidelines for those services. For each car, you only need 1 family per household, so you don't want other people from other families in your car or congregating near the window where that exposure could be increased. You shouldn't have anybody out of the vehicles. Everybody should stay in their car throughout the remainder of the service. And then cars should also be spaced a decent amount from one another. So those are just some guidelines for that, and we can't, if these guidelines aren't followed, they can stop the services. So we want to make sure that people are abiding by those and that churches are able to get together and worship, but in a way that's safe and keeping your congregation safe.
Absolutely. And I think that the mayor also put out put out information this week on how, or last week, just before Sunday, on those proper measures if you're going to do the drive-in church as well. So look on our it's on our Facebook page. Great. So take a look on there, and we'll be able to provide you with that information.
Another question we get is, can I take my children in the grocery store with me with our new public health order?
Another good question. You've seen the public health order come out this week. We want one family member in a store at a time, so we don't want the whole family going in there. However, we do understand there are extenuating circumstances. If you are a single mom, dad, or a single parent or guardian, and you don't have a babysitter, and the children are too young to stay in the car, they can't stay home and take care of themselves, we understand that. So if at all possible, please be the only person in the store, but we are making exceptions for instances like that. Another good question is, should I be wearing gloves?
You'll see a lot of people out and about who do have gloves on in the grocery store and things like that, and that is okay to wear those gloves. When you are wearing those gloves, though, you need to make sure that as you're touching things, you are still getting germs on your gloves.
Yes.
So don't wear gloves and then touch your face, because you will still.
We've seen a lot of that.
You will still transfer those germs to your face. If you are wearing those gloves, you still need to be mindful of what you're touching and where, those high traffic areas, but then also make sure that you're disposing of those gloves after they're contaminated and not reusing those, because that will just spread
Absolutely.
the germs.
Absolutely.
This is a question I think a lot of people don't really know kind of what we're doing here. So what is the health department's role in the COVID-19? What are we doing to help this?
So during COVID-19 or any type of pandemic or epidemic, public health is going to be the lead agency. And actually, ironically, we talked about this on the radio yesterday. It's actually Public Health Week. And a lot of people in the community, they wonder, who is public health? What exactly do they do? Well, public health is into preventative health. And so our mission is to head off diseases before they start. Or in this instance, we see a pandemic or an epidemic in our community, and we're trying to do all that we can to prevent it from spreading further. We're into population health, protecting the large population. So during this time, public health across the world has taken a lead role in this, and we're providing guidance to leaders and to others in society who are making the plans to make sure everyone stays safe and healthy. But on a local level here's what we're doing. If anyone out there tests for a case or any testing, we know about it, or if we don't, please send in that information. We need to be knowing about it. And any positive cases that we have, we're the ones that take a lead role, make contact with those positive cases. We want to find out who your direct contacts are, and I think we'll talk a little bit later about what is a direct contact. But we want to know who have you been in contact with, and we want to know if those individuals are exhibiting symptoms, and that's where we can provide guidance to prevent the virus from spreading further. So that's been our role here in public health, and you'll see we'll take a look at different pockets or problems in the community that may contribute to spreading the virus. If we find those, such as a great example is the congregating in grocery stores or in our commercial stores that are essential businesses, we saw that as an issue. We said, hey, this is a great way to spread the virus. So public health steps in and we put in that order to help prevent that. So when we do those things, that's our job as public health, to find the issues and put in measures in place, or provide guidance to put measures in place to prevent the spread of illness. A lot of times it's on a background level, like we're providing vaccinations, doing food inspections, very low-key things a lot of times people don't realize we do in the community. But when we have a pandemic like this, you're going to see public health really come to the front lines. So, great question. Where can I get tested? That's a great question that people have been wanting to know.
This is a popular one. To know I'll start by saying, if you think you need to get tested, you should call your primary care physician.
Yes.
That is the first thing that you should do. They're somebody who know you, and they can recommend your next steps if you should go get tested or if it is another issue. So that should be your first step. Jenny Stewart Express Lab is testing off of Eagle Way Bypass, and they are testing without a doctor's note. But we do highly recommend that you contact your primary care physician first. Many of these physicians in town are testing for their current patients, so you just need to contact those and see where they put you.
Good answer.
What should I go to work is another question. Should I be working right now, or should I be staying at home?
Awesome. So a lot of individuals have had a lot of questions. They've heard maybe rumors or heard things about in their business. Maybe there was a confirmed case in the business and they have a lot of questions. Well, should I be going to work? Well, rest assured, if someone in your workplace, let's say, have tested positive for COVID-19, if you are a direct contact, the health department is going to be in contact with you, and we're going to be in contact with that employer as well, just to make sure we have everyone targeted for who has ever been in direct contact with this individual. Now, we will also provide guidance for that employer, how to sanitize maybe the locations where that infected employee might have been, just to make sure that it's not passing to others. So if you have not been contacted as a direct contact, you can still go to work, but again, talk with your employer about that, because they're going to have a little more information on your particular circumstance. But if you have not been deemed a direct contact, all that we ask is that you monitor your symptoms. If you do exhibit any symptoms, please let us know, or please call your primary care physician and you can get tested. But in the meantime, if you haven't been deemed a direct contact, you're able to go to work, unless your employer says otherwise. That's going to be up to you and your employer. How can I contract COVID-19 is another common question that we've gotten.
Yeah, so COVID-19 is more transmittable than a lot of other viruses that we see. And like other viruses, it is contracted through particles coming out of someone's mouth or nose, or germs that come out and then fall on a surface and then are touched on that surface. And the New England Journal of Medicine says that COVID can live in the air and on surfaces between several hours and several days, and that the virus is viable for 72 hours on plastic, 48 hours on stainless steel, 24 hours on cardboard, and 4 hours on copper. So that just means we have to be really, really diligent to wash our hands, to make sure that when we are out in those places where there's high risk of exposure, that we're careful, because it does last on surfaces for a while, which is why we're being so restrictive in what we can do and what we're allowing, so we can stop that exposure.
And I think an underutilized resource is washing your hands. Mm-hmm. That's something we've preached it, and I think people are taking it more seriously now as things have progressed. But honestly, washing your hands frequently before you go to the store, after you get home from the store, don't touch your face in the meantime. Doing those things it's gonna do much more than you think. It's a great, easy way that we can prevent the spread of the illness.
Another question we get is, if a person has been isolated from COVID-19, how do you know when that isolation period will end? How do we determine when that isolation period will end?
Okay, so a person, they need to be symptom-free for 72 hours. That's going to be 3 days without medication. So let's say you're taking Tylenol for your fever. You need to be fever-free without any Tylenol. So you have to be symptom-free for 72 hours. That's 3 days. In order to be released from self-isolation. But it has to be at least 7 days past when the symptoms started. So regardless, if your symptoms started on Monday, 7 days from Monday, you might be off quarantine, or you might really be released from that self-quarantine or self-isolation if 3 of the past days, you've been fever-free, symptom-free, and haven't had any type of symptoms from COVID-19. So I hope, is that clear enough, you think?
Yeah, I think so, but a lot of people are confused too, what isolation and quarantine are.
Oh, good question.
So if you're in isolation, you are a confirmed COVID patient.
Yes.
And that means you're in kind of your own room, your own area, you're not really going around other people in your household. Mm-hmm. If you are a direct contact of someone who's confirmed COVID, you are quarantined, which means you stay in your house. When people are off isolation, the CDC also says that you should still remain quarantined for 14 days, meaning in your household, regardless of if you're out of isolation. So there's a little confusion with those two terms, but that's kind of the general.
A lot of numbers
right
to
now.
couple, yes.
Yeah.
But again, if you need clarification on any of this, our Facebook has been a great resource to ask questions. So if you message us with questions, we can provide clarification on any of that for you.
If a person, we just answered that one.
Oh.
Is it true that ibuprofen can make COVID-19 worse, can make your symptoms worse?
Now, we have seen articles floating around out there that talks about non-steroidal, how do you say that? Steroidal medications will make COVID-19 symptoms worse. But there is no evidence from the FDA that this is true. Again, I know we just ask patients, I don't want to provide any guidance on exactly what to take. You need to talk to your medical provider for that, because different patients are going to have a different set of health issues. So talk to your primary care provider who knows your medical history, and they're going to be able to provide you guidance on medications you need to take if you're suffering from COVID-19. All right, the next question we have here, what is a contact and how do you know if you're a contact? And they say contact, but I think you're meaning direct contact.
Yes. So there's a lot of different terminology. Someone who is confirmed COVID is considered a case. So if you hear us saying we have 36 active cases, that means we have 36 people who have COVID-19. If you are a direct contact, you are someone who has been within 6 feet for 20 or 30 minutes, 20 to 30 minutes or longer, with someone who is a case, someone who is confirmed COVID positive. Those direct contacts we are daily monitoring, so you will be notified by the health department if you are a direct contact of someone with COVID-19. If you are someone who is interacting with someone who is a direct contact, we just ask that you take extra precautions and wash your hands and continue to disinfect things, but that is not the same as being a direct contact of a case. So there's a lot of terminology. It can be really confusing. There's also some information about that terminology on our Facebook page as well, that gives a little clarification of what all that means. Another one, we talked about this one a little bit, is quarantine versus isolation.
Oh, and Chloe did a great job. Again, quarantine, if you're a direct contact and we suspect that you've been a direct contact with someone who has been diagnosed, we ask that you quarantine in your home. But should you exhibit signs or symptoms, then we ask that you self-isolate from everyone in the home and try to just distance yourself so you're not spreading that virus. So there is a difference between the two. And one of our last questions here, is loss of smell and taste a symptom of COVID-19?
Yeah, so we've gotten this one a handful of times too. It's coming as we get more cases and we get more people with COVID-19. We're learning of how different people react and some different symptoms that people are experiencing. And there's a decent amount of people who are saying that they're experiencing loss of smell and taste. Along with that, the symptoms are shortness of breath, dry cough, fever. Some people are saying that they get some body aches and just general fatigue. But it is hard to know, what your symptoms are. Everybody is different, but loss of smell and taste could potentially be a symptom of COVID-19 if you're experiencing that. So.
And I think you mentioned it, the key symptoms that we've seen that have been the most common is that dry cough, fever, shortness of breath. Mm-hmm. And then in addition, there's a whole slew. Again, you can find all of this on our Facebook page. Chloe's done a great job of updating you guys and keep getting all this information on there. I think that wraps it up for the questions so far, but again, if you would have follow-up questions to these or additional questions that maybe we haven't thought of or you forgot to ask, you can always ask on our Facebook page. Just message us and we'll try to get back to you as quickly as possible. Please continue to social distance. Thank you guys and businesses out there who are doing that. We really greatly appreciate that. It's making a difference and we do appreciate that. But continue to wash your hands, continue to social distance. Just stay calm, clean, and cooperative, and we're going to get through this, guys. We appreciate it. See ya.